Hi, everyone, and welcome to this webinar highlighting one of the many behavioral health treatment program models that we have here in Virginia. My name is Nelson Smith. I'm the Commissioner of the Department of Behavioral Health and Developmental Services. And first, I want to thank everyone at the Virginia Hospital Healthcare Association for hosting this event and asking me to participate. I think in a few moments, you're going to learn more about the Riverside Health System Detox Program during this webinar presentation. But before that, I want to take an opportunity to highlight our vision and direction here at the agency. Um, it's a shared vision to strengthen Virginia's behavioral health system and to better serve Virginia patients and families who don't know how to access treatment or services. Our system has many stakeholders, including DBHDS, the community service boards, private hospitals, families, advocates, law enforcement, and many others. The roles of these stakeholders differ, but each one is just as important as the other, and they all work towards supporting our patients and our families. Enhancing our system requires innovation, and that means in the public and private sector. We want to continue to collaborate and dialogue and identify opportunities for improvement to develop the strategies and also to execute on those strategies. Here at DBHDS, we have a very broad mission that affects hundreds of thousands of individuals with behavioral health disorders and developmental disabilities and their family in every corner of the Commonwealth. We are committed to ensuring that they have consistent access to quality care no matter where they live. In order to do this, we're focusing on strengthening our workforce, expanding the continuum of care, and modernizing our systems and processes. Doing so will have a tremendous impact on delivering these quality services from inpatient to outpatient, early intervention, intensive services for people seeking mental health, substance use disorder, or developmental disability services. We'll be working to ensure that we have the staff to do it, ensuring that we're making it easy and possible to do business in Virginia, in part by supporting strategically developed supported services in the private sector. We're going to work together in order to provide the much needed improvement to transform the system so that our Virginians can thrive in their communities. So I want to thank you for your partnership, interest, and commitment to being part of the solution in enhancing our behavioral healthcare system. And now, as they say, on with the
Good afternoon, everyone, and thank you so much for joining us for today's webinar. My name is Jennifer Wicker, and I serve as the Senior Director of Policy and Government Affairs for the Virginia Hospital and Healthcare Association. In addition to thanking you all for being with us today, I also want to acknowledge Commissioner Nelson Smith and thank him for his introduction and for the ongoing collaboration between the Department of Behavioral Health and Developmental Services and the many stakeholders and advocates across Virginia's behavioral health system. Despite the unique perspectives held by many stakeholders, we all have at least one thing in common: a passion for improving access to behavioral health care and services for patients and families in need across the Commonwealth. Making progress towards achieving that goal requires many things, including collaboration and open communication to identify the opportunities where we can work together and help solve systematic challenges. This webinar series is one small step in that direction. Over the course of this series, we'll place a spotlight on innovative hospital programs that have received some funding from DBHDS and the state. Joining us for today's installment are Stacey Johnson, President of Riverside Behavioral Health Center in Hampton, and Tim Webb, CEO of Safe Harbor Recovery Center in Portsmouth. Over the next 30 minutes, we'll discuss their work and the positive results their programs have produced for patients struggling with substance use challenges. Welcome, Stacey and Tim.
Thank you so much for having me here.
Thank you so much.
So Stacey, let's start by talking about the Riverside Behavioral Health Center and the continuum of services for adult patients with a substance use diagnosis, and how Riverside's detox program and outpatient programs such as intensive outpatient and partial hospitalization work in tandem to increase success towards recovery. And if you don't mind, please briefly touch on the future plans for Riverside Psychiatric Emergency Department.
Sure, absolutely. So many folks know RBHC, or Riverside Behavioral Health Center, as a facility that provides inpatient psychiatric treatment. And we continue to do that for both adults and adolescents. Those services really focus on treating adults with mental health needs that require hospitalization. So really anything from a serious mental illness to anxiety, depression, postpartum, and really, quite honestly, anything in between. However, we know one of the things that continued to rise as the COVID pandemic started was the need for addiction services. So after the growing need in the community, RBHC really went to DVHDS, sought an opportunity for partnership, and really wanted to focus on treating addictions as well as mental health. So we began by offering inpatient detox, grew an amazing team of professionals to help patients on their recovery journey. We added a partial hospital program, which is really that day treatment model. And following that, an intensive outpatient program, which is about 3 hours a day, 4 days per week. So the PHP and IOP programs really focus, as well as detox, quite honestly, on treating the whole person. So we offer pharmacy groups, spirituality or chaplain groups, rec and art therapy, as well as, of course, the traditional therapy and relapse prevention. We also have many patients within our services that have a secondary mental health diagnosis. So we do have a psychiatric provider who's able to meet with these patients, really help patients with medication management and such. We also have another amazing feature is our certified peer recovery specialists. We've found that this connection with peers have really helped folks be successful as they focus on the continuum of care. I think it's worth noting that as our services grew, we recognize the need to be a bit more flexible in our treatment as well. So we now have a virtual component. This really helps patients who can't be here in person continue to get treatment. You know, we have some amazing success stories as a result of that. Patient who had a loss and was able to continue to engage in treatment even though they had to travel for the funeral. It was really, you know, amazing. Or another patient who did have COVID, wasn't able to physically attend, but could continue their recovery and really get the support that's needed in a time when relapse could be really likely. You know, I had a patient just the other day come and tell me how for the first time since she was a child, she felt like her brother was beginning to trust her again. She was able to spend time with her niece and nephew. You know, it's really amazing to have these stories that, you know, show that the work that's being done can truly change lives and really help support our community. We also want to continue to engage patients after they leave. So we have an opportunity for folks to come back, join a weekly aftercare group, and really get support from the group that helped them, you know, begin early recovery. So, you know, certainly huge thanks to the Department of Behavioral Health and for the partnership to really grow these services within the community. And then just to touch on the second part of that question, Jennifer, and I think we'll probably talk a little bit more about this too later in the program, is Riverside is really committed to growing behavioral health services. So we recently announced that we would be opening a psychiatric emergency department right here on our campus in Hampton to really help you know, bridge the gap for folks in crisis and getting to services that are needed. So we're super excited for that to come online late next year.
Wonderful. And I know there are a lot of other people that are super excited about the Psychiatric Emergency Department for sure. Thank you for sharing just a snippet of the amazing work that you all are doing in Riverside. So one of the things that has been well documented during the pandemic is the increase in substance use and drug overdoses in the US. From the hospital perspective in Virginia, we saw a decline in overall patient volumes across the state, including inpatient admissions and emergency department visits. However, the data shows that there was one notable exception. Hospital admissions for substance use treatment services increased during the pandemic. With that context, Tim, please tell us about Safe Harbor and the services it provides and the trends that you've observed since the pandemic began.
So as you bring that up, Jennifer, the first thing that comes to mind is I remember somebody saying that as we came out of COVID, everybody would come out one of three things, either a chunk, a hunk, or a drunk. And I think it's true. Some people worked out, some people laid around and ate, and some people drank and drugged. And we saw a lot of that. We saw a lot of social isolation, a lot of depression, a lot of hopelessness, increased suicidality. Folks were so isolated. I think that was the biggest thing in terms of the patient population. As we talk about Safe Harbor and what we do, one of the things that Stacey alluded to was some of their virtual programming. We've done a little bit of that. I think that's a wonderful opportunity, not only for her, but also for what we're doing with our folks. But one of the virtual things that we've done is we have an app called Cared For, that if you've come through our program, all of our alumni are then able to join the Cared For app and stay involved that way. Because we've had folks have come as far away as Galax or Bristol, Northern Virginia. So coming to an alumni event may be difficult, especially if we're talking about our Medicaid population, who oftentimes don't have the resources for transportation. But everybody just about has a cell phone now, so they can get in touch not only through calling, but they can get in touch with the Cared For app. And it operates just like Facebook. We manage it. We make sure we manage the content. We keep up with who's on there and what they're doing. But we can put articles out there, tips out there. People can connect and reconnect. So that's been a big part of it. Our alumni coordinator, Charlotte Pawd, is the one who manages that app on our behalf. And she's done some amazing work with just outreach to alumni, having alumni activities, those types of things. In terms of Safe Harbor, we've had a really interesting journey. I got here 4 years ago to an empty shell of a building and 3 administrative staff that were hired for me, and we got licensed in March of 19, got our first insurance contracts in August. They were all Medicaid, and it was off to the races. Our parent company, Summit, had never really done Medicaid before, but as we all know, with Medicaid expansion in Virginia and then the rates afforded everybody by the arts, it was something that we could get into. And as Stacey knows, the need is just incredibly great. We filled up very, very quickly. One of the things that we went from 26 beds to 28 during the pandemic and then to 30. But one of the other interesting things that happened during the pandemic, Jennifer, was we had gone in network with Optum and the VA's community care network. The Hampton VA shut down. All of the domiciliaries for veterans shut down. And as we know, Hampton Roads has more veterans than anywhere else in the world. We began admitting veterans and wound up now with 30 beds at our London Boulevard site strictly for veterans. So we have a veteran-specific program with equine therapy. We have what we affectionately refer to as laugh therapy. We have a recovering vet with PTSD who's been through combat, who's a professional comedian that comes in a couple times a month. We're about to start a full EMDR program, neurofeedback, but our vets get specific programming. Then we have a 20-bed campus for our community-based patients on Elm Avenue. So we work with a combination of Department of Corrections folks that we have on an RFP contract with the state and Medicaid, and that's our community-based program. And that one stays pretty full as well. And then we were able to expand outpatient services. We have a partial hospitalization program on Queen Street here in Portsmouth for both veterans and Medicaid folks, and then an IOP that meets in the evenings from 5 to 8 that right now is only for the vets, but we're we're in the process of trying to credential with all the managed care MCOs so that we can then have an option for our Medicaid population, because yeah, as everyone in Hampton Roads knows, that the need in Portsmouth specifically is so great. And the working relationship back and forth with Riverside has been phenomenal, because as someone not from Hampton Roads, not from Virginia originally, I didn't understand until I got here that there's this side of the water and then there's that side of the water, and nobody goes to the other side of the water unless they have to. So we've been able to really work back and forth, and it's really two different catchment areas when you're talking about the community-based population.
Wow. Sounds like you guys are doing some amazing work at Safe Harbor and expanding, and love the focus on the veterans population. That's awesome and so
Thank
needed. So you briefly talked about partnering with Riverside. So I'm going to switch and focus on that a little bit. And so Stacey, I'm going to have you start, if you could, after I ask this question. So you mentioned the continuum of care a moment ago, Stacey, and I want to ask both of you to expand on that by sharing some insights on how two different providers, such as Riverside and Safe Harbor, identify opportunities to work together and to partner, which is something we want to encourage when we're talking about providing comprehensive services across the continuum. So Stacey?
Yeah, sure. Absolutely. Happy to answer that. And I think I'm going to take just a little step back and answer what is the continuum of care. I get that question a lot, because I often say you find the most success in treatment when a patient follows the continuum of care. So what does that mean? And I think, for me, the easy comparison is to medical facilities. The patient goes in, gets a hip or knee replacement, they start, potentially hospitalized, then they go to a rehab, then they step down to intensive physical therapy, and then down to monthly and bi-monthly visits. So we really want to mimic that in mental health and addictions. If patients start off at that highest level of care, how do we continue to have them, follow perhaps detox with us, and then residential treatment with Tim, and then perhaps back to us for that day treatment or partial hospital program, then step down to an intensive outpatient and general outpatient as well. So I think the reality is collaborations like this are critical for the patient. It gives the patient an opportunity to find success in their treatment and really growing their care team to extend, even beyond just one facility. So these relationships are really, really important. So, having care managers at Riverside that connect with the admissions department at Safe Harbor is just super important. And really, the patient's being put first. If we say, okay, we can have that patient stay here until that bed becomes available, because you always want to work on those bed-to-bed transfers as well, so that there isn't a gap in somebody's treatment. I think just in terms of quality patient care, there's no one facility that's an expert in everything, and there's certainly enough patients to go around. We know Tim's an expert in residential treatment, so what a wonderful opportunity for us to get the patient, stabilized from a detox perspective, and then into good hands in residential care, then back to our partial hospital or day treatment program. So it's so great for the patients to be able to have this opportunity for facilities like us to collaborate and communicate on what's best. It's always putting the patient first. That's how you get the best outcomes.
Absolutely. Tim, anything you'd like to add to the partnership conversation?
Sure. I'd like to certainly say that working with Stacey's team has been a joy. They do a great job of detox. I don't have to worry about doing detox. I can send somebody to her for detox. She's going to kick them back to me, and then we can kick them back over to her for her level of care. And so it works really, really well together. In fact, one of the things I think that's important that on our end is we have some preferred referral sources, where if Riverside has a patient that needs to get in, we may work with them more quickly than somebody else, simply because there's such good back and forth. We've got 2 or 3 really preferred referral sources that we try to make sure that they're always taken care of, to go up the continuum and down the continuum. One of the things that I think sometimes we forget about and I don't know if Stacey runs into this issue, but I certainly have run into this issue, is someone finishes residential care, but they've come to us homeless. When they leave us, they're homeless. Housing is so vital. So one of the things that we're committed to doing is trying to find some homes in the area or some other housing component where we could look at a sober living environment, halfway house type of thing. We're in the process of applying for a conditional use permit right now for a particular site to use as a sober living for veterans, but I'm also looking for a couple spots that we could have Medicaid males and Medicaid females, with the idea being you go to Riverside or wherever for detox, and you come to us for residential, you step down to a partial, but you have a place to stay that's safe. And then when you're ready to step down from that, you step down to the intensive outpatient maybe in the evening and work a job and save your money. And by the time you're done in the sober living environment, you've been in the continuum of care now for 6 months to 18 months, depending upon your issues and you know, whether it's what your payer source is and those kinds of things. But when we look at, oh, I went to detox and I got out, or I went to res and I got out, that's a recipe for relapse. So we really have to make sure that programs like Stacey's outpatient or our outpatient, or even those housing options, are made available to people so they have the entire continuum.
Absolutely, absolutely. So with the 5 minutes or so that we have with the webinar, I want to switch our conversation to talk about challenges and opportunities. I'd be remiss if we didn't focus on those challenges, right? So as each of you think about the behavioral health care delivery system in Virginia and the challenges faced by public and private partners as it relates to staffing and resources and the needs of patients and families and other stakeholders, please share one example each of what you see as a pressing challenge and a tangible opportunity. And if we could start with Tim.
For me, I would say the most pressing opportunity, and I actually have to really, Jennifer, give you two, if that's
Sure.
okay. And I'll be quick because I want Stacey to have
As long as you're
some
quick,
time.
of course.
But the first one, I think Stacey would have to jump in and agree, is finding staffing, especially nursing staff. That is incredibly difficult in terms of what we can do about it. Offering retention bonuses, sign-on bonuses that are tied to a length of commitment. That's one of the things that we can do. I think coming out of COVID, what we saw was nurses were able to travel at huge exorbitant rates in ICUs. Then they were able to get fairly high rates with agencies, and now they don't want to take what's a reasonable rate that a facility can pay and still pay its bills. So that's a big challenge. The other big challenge that I think we all face is as we go into potentially a recession and we see tax dollars potentially dry up, is making sure that we continue to lobby with the Virginia legislature to ensure that rates stay where they are and that they at least not go down. Yeah, obviously with inflation, I'd love for them to go up, but if they just don't go down, because if we have to pay more for staff but lose that reimbursement, then it's going to drive either people out of the business, or it's certainly going to drive down some of what we're able to do.
Okay, thank you. And Stacey, one, possibly two challenges and opportunity.
Yeah, absolutely. So it's certainly a loaded question, and like Tim, there's a million things that jump to mind, and it's difficult to prioritize those. So I think generally speaking, our community is struggling to keep up with the demanded need for mental health services. So I think the easy answer, right, is let's make sure we have the continuum of care. Let's make sure we have all these services available. And mind you, I'm probably, I see things from a different lens. We have 4 emergency departments within Riverside, so I see the need for crisis services really specific to behavioral and mental health, and that's really highlighted for me on a daily basis. So, you know, when we look at this on the front end, having those crisis facilities available, like the emergency department we just spoke about, or empath units or specific areas in ED. So really having those available for patients and families, I think, is important. And then on the back end, having the partial programs, the intensive outpatient programs, et cetera, that really help patients stabilize within a community is really critical. Now, in terms of the resources, I certainly think that we have an opportunity as a state to look at reimbursement, look at really the cost of providing services, and ensuring that those align, and identifying areas where we could perhaps improve. And then it's really important, again, for us to come together as a behavioral health community, and focus on how we can really provide these services amongst all of us, not just one facility.
Got it. Got it. So once again, thank you so much, Stacey and Tim. It's amazing how quickly 30 minutes goes by, right? But thank you so much for being with us today. And again, I want to thank Commissioner Nelson Smith for his opening remarks. And thank you, audience, for joining us. If you have any follow-up questions, please direct them to my colleague, Julian Walker, and he can be reached via email at jtwalker@vhha.com. Again, that's jtwalker@vhha.com. And please join us for the next webinar in this series on November 17th at 12 p.m., where we will feature Carilion Clinic and their comprehensive psychiatric emergency program. Thank you all so much, and be well.
Thank you for the opportunity.
Thank you.